Patty Lager, thank you for joining me. It's an honor actually. I don't believe we met, have we, in person?
Not in person, no, just through the video.
So Patty, you're I'm speaking with you because you have, I think, a one of the most unique online courses, Human Anatomy and Physiology, Part One on the Dr. Morse online school, and Part Two, I believe, is coming next week, as
Yeah.
far as I know. Um, and it's an amazing course that really gets to, well, I mean, your course covers electrical chemistry, cell biology, introduction to the human body and histology.
Mhm.
Um, I hear people talk about your course all the time. People that attend your classes as you're recording the course. When I do the Zooms, people, if there's one course they talk about, it's always yours and always your approach. And I'm interested to see how that approach came to be, how you came to be, and why the courses are the way they are. And I think it's all down to your approach. So tell me, was there was there a point in your first of all, tell me about you and how you got to do what you're doing today?
Wow, it started a while ago, back when I was, well, I guess in college, I was a pre-med student, then I went to medical school, and I really had a passion for wanting to help people heal. And, I wanted to practice medicine. That was my goal. And when I was in medical school, and the first couple of years wasn't so bad because it was just book learning, and we did a little bit of clinical medicine but not a lot. But when I really started getting more into the clinical medicine, and I just saw how disconnected I felt with the patients, and I had always had a passion for natural living and um, using the least harmful approach. And I thought that was what the Hippocratic Oath was all about, first do no harm.
Right.
But it seemed to me that these, I don't know what the medications and the approaches to the allopathic treatments did not seem to be the least harmful options, in my opinion. And I started seeing negative consequences of a lot of different healing modalities. And I should put healing in quotes because I don't know who they were benefiting. They didn't seem to be benefiting the patient. I think they were benefiting somebody, but the patients seemed to be just kind of in the crossfire, and they were, in some cases, having severe outcomes. So I started becoming quite disconnected. And then I too, having been required to receive an injection during medical school, had some negative impact. And then people in my family, were having the same. And one of my cousins actually passed, her daughter, or her son, I'm sorry, one of my female cousins, her son passed away after the MMR.
Goodness.
And all of this happened while I was in medical school. And it just kind of was the perfect storm to create a situation that I knew I had to leave. I could not continue doing this. One thing you learn when you're in medicine is that there's standard of care, and you have to do certain things and approach your patients in a certain way. Because if you go outside of that, you lose your license, you lose your right to practice, and then, everything you've worked so hard for is gone. And I know, due to the recent pandemic and whatnot, a lot of medical doctors that did have integrity left, and they didn't care that they lost their license. And, these are kind of the heroes in the allopathic world. And now they're probably doing more natural approaches anyway. But all of that happened, and I was kind of lost because I didn't know what exactly to do with everything I had learned. After leaving medical school, I ended up tutoring at a community college, and I really fell in love with teaching. And I held tutoring sessions outside of the students' classes. So I was tutoring chemistry and anatomy and physiology. And one of the professors there at the college asked me if I would be interested in teaching. And I'm like, yeah, I would love to. And then that's kind of where my college teaching career began. but I still had, that passion for health and that passion for helping people reverse disease and to feel better. So I started doing a lot of investigation on my own outside of college teaching. I started studying naturopathy, homeopathy, natural hygiene. And when Facebook came about and I started connecting with other people that had similar interests, I soon came to find Dr. Morse. And that's where a whole new door opened. And I really started looking at the body in a different way. When I had met Dr. Morse, I think I had at that point been teaching maybe for about 10 years or so. And I remember I scheduled an appointment with Dr. Morse just because I found him to be fascinating when I watched him on YouTube and the things he talked about. And I remember during that appointment, we didn't really talk about my health too much, which I was okay. I really just wanted to talk to him. We talked about how he viewed the human body and where I was coming from. And it was just, it was like something in my mind. You know how you have these aha moments? It was just a miraculous. I was like, oh my gosh, how could I have been so, blinded by the fact that I thought that the blood was carrying waste products away and the lymphatic system was dumping lymph into the blood. It just, once I got that, and then I continued to learn more from him, I just was so excited because I knew how simplistic healing really was. Coming from medicine, they complicate everything, and they want to make the medical doctors to be these kind of um, just having the knowledge. They're occulting the knowledge and they're not sharing it with anybody, but they're going to tell you what to do. Doctors have maybe 5-10 minutes with their patients and they don't have time to explain things. And I really think that if you can explain something to someone, they're more likely to, get excited and to follow through. But patients go, they're sick, they just take the pills as recommended, or they have the surgery as recommended. And then they really don't heal anything because they never changed anything about their life. They're going back to the same poor lifestyle, poor dietary choices. But Dr. Morse was completely different. And he explained, I mean, he's such a beautiful person. He just had this free YouTube channel where so many people learned so much from him. And it was just a gift, it was just a beautiful gift. And I just hope that, that anyway, that inspired me quite a bit. So having talked to him and having later become a detoxification specialist, and then a little bit after that, coming to work with him in Florida for a year, it's just been an amazing experience. And I caught that bug that he had, shared with me about sharing this information. And I have found myself, even in the, courses that I teach at the college I'm working at, I'm still, teaching in that mindset of Dr. Morse, even though there are certain things I have to go by the textbook. I ask my students, does it make sense that, we're taking these waste products away via the lymphatic system and dumping that back into the blood? I just get them thinking about it, right? I don't tell them that this is what the textbook says because our textbooks don't say that, but I like to get them inspired and to get them thinking outside of the box. And I think it has, even on my allopathic students, it has rubbed off on them. But I'm excited. I'm always more excited to teach the naturopathic students with Dr. Morse because they know what's going on.
Yeah, you're right. And that's one thing that when you do the traditional, what we now call the traditional, more modern or whatever approach, you're not taught to think for yourself, or you're not encouraged to do any of that. You're just encouraged to go there and do what you're told. And for goodness sake, don't ask any questions because you can't possibly know, because they've like this is, I don't know. Who did I speak to the other day? I spoke to someone the other day and I called it the Matrix. The Matrix has put the doctor in a position of being completely unquestionable. They can't be wrong. If you dare question them, then gosh, you've been on the internet, haven't you? You know,
Sad.
and it's your body, right? It's your body. And goodness, if that's the one thing you have a right to, and that's to know what's going in it and things like that, and ultimately that takes away your empowerment.
Mhm.
And I like what you just said, that you teach your students to think and to say, does it make sense to you? Because that's, I think
Yeah,
that's one thing
just
that's missing.
just getting them to ask questions. And I'm always excited when any of my students, naturopathic or allopathic, when they ask questions. I think it's in questioning that we learn, because that's where we get our fill of the knowledge that we're seeking deep down. And that should be encouraged, whether it be in an academic setting or when you're talking to your primary care physician. I think healing is not just healing just the physical form, but healing the mind, body, and spirit. And the mind and the spirit are connected. And when we have a question, we want to know, is this safe for me? Is this going to, what can I expect from this? So, patients aren't encouraged to question.
And when you were at medical school and you were going through this, you had a lot of issues with your cousin and her son. Goodness, how what a terrible
It
thing
was it
to.
was tragic.
So w- that was a unique experience to you. But do you think other your peers, your fellow students at medical school, do you think that there's a point that when you're at medical school, there's a threshold that you have to cross, and you think, do you think some people, or most people, I don't know, do you think some people feel what you felt and then they have to say, I can't question, I just have to keep going?
It's hard to say. I mean, I don't know. I think a lot of times, people get into a mindset and they have blinders on and they just have this one goal. I'm going to get a medical degree and I'm going to practice medicine. And that's anything else, that gets in the way, I'm just going to toss to the side. But I don't know if it's just how my mind works, or I've always just questioned everything. I just didn't sit well. And I always had this fondness of, you know, nature as being the uh, what will guide me to what is correct. And I wish I had known about naturopathic medical schools back when I was applying, because none of them were licensing physicians. Now, a couple of them are, but now having talked to Dr. Morse, I know they too have been kind of taken over by the allopathic mindset. And I know like Bastyr and um, Southwest, a lot of times they were requiring things that I thought were not healthy, during the pandemic for their physicians and for their medical students. So I think that it's one of those things that, you know, we're just in our society not taught to question. And a lot of people are just, it's hard to say. I can't go back in time and, assess how I was different from the others, but maybe they were questioning, but they were just too afraid. I've been always a little bit fearless in my life.
Good. We should all be. We should all be. And with regard to the course you have now, where do you see that going?
The course through Dr. Morse's school, or my like course of action?
Both.
Both.
Uh,
Okay.
I meant the first one, but now you said course of action.
Okay.
I think, wow, that's that's good.
Well, I mean, for the courses, I mean, we wrapped up over the summer. I'm going to be taking summers off from my college teaching so I can dedicate more time to getting these courses out there. So we just wrapped up the course on blood and heart and blood vessels and the lymphatic system. So it's basically the cardiovascular system and the lymphatic system. So I knew that those were foundational courses after the introductory course that we had out already, because that's what Dr. Morse talks about, blood and lymph.
Yep.
So I wanted to make that something that we put out that people could really understand, because those are the two fluids that nourish and clean us. And so this is, we have control over both of those. I mean, obviously our heart beats without us asking it to, but we have control over what foods we put into our body. We have control over what kind of detoxifying and spiritual types of activities we do to clean the lymph, because I do think it is spiritual too. It's nothing is ever just physical. But I think these courses, I think they're going to be part of our naturopathic program for getting more practitioners out there to help more people heal. And I know just personally, many people have reached out to me for help. And I was working with clients a lot for a while. I had to take a step back because my schedule just got a little bit too crazy. But people still need the help, and I wish we had more practitioners. I know there's a lot of them that go through the school, and they're doing amazing work. But I'd like to see more of that for people to find remedy through, because the alternative is not really doing the job. I mean, it's in the United States, we're like, one of the lowest with health outcomes, yet we spend the most on health care. And it's not really health care, it's just disease maintenance care. And so there's a problem here. And, we have this thing with our society that there are so many problems, and we've been conditioned that there are certain things you just don't talk about because, you don't want to offend anybody, or you don't want to make somebody question. And I think we need more of that. And I've been, kind of courageous in my allopathic courses, and my students are questioning things, and I think it's exciting. So it's good to know that, even when you're in the heart of the beast, you can still, make some headway and inspire people to think differently.
I know from my experience that the people that most, I'm sure there's always exceptions, but the people that are most successful in detox are the ones that know and have learned as much as they can. Um, and so you mentioned the spiritual aspect, and I couldn't agree more, because I've seen and I've experienced as well personally, that when you're hurting, when you're in pain, when you're suffering, or equally when someone that you love and care for is suffering, suddenly suddenly you're it's easy to forget. It's easy to forget everything you've learned, and I think I'm saying that we can underestimate. People use the term brainwashing, conditioning very easily, and I think we all know it's real, but I think it's so embedded because, well, conditioning is everything, I guess. We can say it's everything. Everything, our existence is conditioning. What would you say to someone that they hear the word spiritual and they think new age, hippie, what does that mean? Doesn't really mean anything. But yet I'm 100%, 100%, 1,000% with you that it's more than knowledge, because when it affects you or someone that you really care for and they're suffering, I think that's, from my experience, only from my experience, that's when I've seen people at their weakest, and they forget that sometimes you have to go through your body's um, putting out something that's been in there for a long time, and that doesn't necessarily that's not going to be a pretty experience. And we're taught that you go to someone who knows about your health, and they will do something or give you something to make you feel better. They don't tell you that, or this method, which I think is the only method, can be an ugly ride at times. And I'm not saying that as a, oh, be careful, you shouldn't do it. I'm saying that as you should do it. But when you're in that dip, when you are in pain on going through something that you never thought you'd go through before, expelling more mucus than you've ever imagined existed, difficulty breathing, all that kind of stuff. That's when people are at their weakest. And then I think I'm probably wrong, but I think in one of Arnold Ehret books, he talks about people that are in discomfort because they're on all fruit, and then they'll go back and eat whatever it was they used to eat, and then of course their detox will stop, or in layman terms, they will feel better, and then they'll say, "Oh, you see, the fruit caused the problem." But of course, what the fruit did, as we know, was reveal what the problem was. So back to my question: Would you, if or have you encountered anyone that's like, oh, I don't really do spiritual. I'm perhaps, they have their own faith, or they're afraid of that word. I think like you, I think it's equally as important as the knowledge, if not more so. How would you approach someone that tells you that, they back away from spiritual, or they're afraid of it, or they're complete atheist and don't want to have anything to do with it? How how would you approach that? Because like you, I think it's an imperative part of the healing process.
Yeah, I mean, I think everything is spiritual. I mean, I don't think we can get away from it. We are spiritual beings and having this physical existence. I really kind of think, honestly, the more that I've been on this planet, I think that everything we experience is a lesson made just for us. And we can either go through the lesson as we're meant to in the truest and sometimes the hardest way, but we're learning those karmic spiritual lessons that will, I believe, help us ascend and learn what our soul was desiring to learn in experiencing this physical incarnation. And whether that be a detoxification program or having to endure a very abusive relationship with someone or whatever. I mean, there's a plethora of experiences that are grueling on the soul, and we remember these things, these lessons of life. But when you take a step back and you look at it spiritually, and you look at, okay, I, for 20, 30, 40 years, was filling my body with just, processed foods that were congesting inside of me. And now I have these aches and pains, and I've been diagnosed with this disease. I mean, do I go with more processed treatments to try to cure that? Or do I try to cure this in a way that the body, in its infinite wisdom, already knows how to do? I mean, we have pathways of elimination that once opened and we allow things to become, dislodged and released, we get to the other side and we feel amazing. And it wasn't until we had pioneers that went through this, like you mentioned, Arnold Ehret, and the other great pioneers of natural healing and natural medicine, that they were trying to reach the masses and say, eat nothing but fruit, or do a juice cleanse, or take these wonderful herbs and help the body strengthen. Because it's not until you experience it that you realize just how amazing and miraculous it is. And yes, it is a pain to go through, but and I've worked with clients, stage 4 cancers, that when they're doing the grapes for so many days and they're getting sick of it, and it's just and they're not where they want to be. But if they just hold on to that faith that there is a path, and it's asking you to be stronger than you've ever been before, and this is the discipline that, in many spiritual practices, that is at the heart of their teaching. I mean, yes, we have major religions like Christianity and Islam and Judaism, but they each have kind of their esoteric teachings where they talk about discipline. In all of the great religions, discipline. And some of them even get into the cleaner diets and the healing diets. So I don't want to just limit it to those 3 religions, all, indigenous populations. When we can discipline ourselves, we can almost be we're so powerful in that respect. And I think that's one of the lessons that humans need to learn, especially in this day and age where it's so easy to not discipline ourselves. I mean, there's so many things distracting us and so many bad things to hurt us, whether it be food or toxic media or anything. Can we stay and rise above all of that? I think that's the main lesson of life, is to just kind of ascend above and to be at ease with what you're going through, and just know that it's all a lesson just for your enjoyment.
Didn't you've said something, didn't isn't one of the books from the Essene Gospel of Peace that doesn't that just talk about everything we're talking about? I think one, isn't it like book 3 or 4 or something, is just completely. I remember years ago I read it. I thought it was shortly after I came across Dr. Moore, so that must have been 2009 or 8 or something. And I thought, my goodness, they knew. They knew,
They
right?
did. Yeah, the Essene Gospel of Peace is amazing. Yeah, I was on I gave a presentation not too long ago where we were talking about that book, and it's such a foundational book. I think many people in our line of work have read that, like yourself, and what it describes, what the body goes through, and how it's just, if we just trust, you know, nature, it will heal us.
It when I went through a period of helping people after I did Dr. Morse's level 1 and 2, and I had a little spiel that I gave to every new person I spoke to, and it started with something like, if you scratch yourself, if you just scratch your skin, just a little scratch, your it will heal by itself. You know it healed. You can put a plaster on it to keep it clean or something, or clean it, but the healing is done by the body. You don't have to think about it. It doesn't matter if you're an atheist or what religion you are, it heals itself. And if you have a really big cut, you can get stitches, but the body still heals itself. And if you break a leg or break a bone, yeah, they can isolate, they can restrict the movement, but the actual healing is done by their body. So what does that tell us, right? It tells us that we're designed to be scratched and we're designed to break a bone. The nature, I know some people get triggered by the word God or the creator, or it doesn't really matter what word you use. The intelligence that created living things has accounted for all of that. So does it not stand to reason that the body knows everything it needs to know? All we have to do is follow the rules, because you
Mm-hmm.
can't sit still and eat and not move. And a few months ago, I think I was on a Zoom call with you, and you said something that I've never forgotten since, and I don't think I ever will forget. And it's something, again, it's simple, right? You said the body's designed to move, and I thought, oh. And it's just like what Dr. Morse talks about. He tells you some things that are staring at you in the face, and they have done, and it's stared at you in the face all of your life, and you've never quite given it the attention it deserves. And I think that just shows, um it just shows how most people who are victims of the society, of going to work and trying to, struggling to live, and doing, what do you do when you live a life where you're sitting down most of the day? You try and make up for it, maybe by going to the gym, and if you can do 2 hours on the treadmill, then somehow that's okay for the rest of the week. um I don't know. You know what I mean, don't you? That we're the options that we've got as a mainstream, again, are things that are fed to us rather than us realizing what the answers are ourselves. um so it still comes back to self-empowerment, self-questioning, having faith that the body knows what to do. It doesn't matter whether you understand it or not. You just have to follow some pretty simple things, because the what you have to do isn't difficult. You don't have to read
No,
a
that's
100
the
page
easy
book.
part.
Say again, sorry.
That's the easy part. Just, eating fruit is easy.
It is. It is. It is. Wow. So, tell me, the people that when you do your courses consisted of classes that you record and people are there, right?
Yep.
So, for anyone that hasn't been, when they take your course, what sort of what's the format like? Are you talking and teaching most of the time? Do you take questions from the people on your call?
Yeah, I do about an hour of sharing the lesson, um, because I do have to get the information out there for it to be a course. But then we have an hour or more. Sometimes the Q&A sessions are longer than the class itself for each time we meet, where it's nothing but questions. And sometimes it's about the course material. A lot of times people just have health related questions, or maybe they're a detoxification specialist and they're trying to understand a case they're working with or a client they're working with. So there's so much meaningful discussion when we're all interacting in the Q&A sessions. I remember when I first started giving these courses, I was unsure. I'm like, well, should we be recording the Q&As? And Dr. Morse was like, most definitely, this is where the good stuff is. This is where the students are, really trying to understand by applying what they're experiencing or what they're working with.
And how does level two differ from your level two, differ from your part two, sorry, differ from part one?
Well, part one, I just wanted to get the foundational courses. We had to talk about introduction to the human body. So what are some of the terms in the medical world that relate to the body? Because a lot of times detoxification specialists, when working with a client, the client is going to maybe share some medical information with them, and it's all written in allopathic lingo. So you need to understand what that means in order to make meaning of it. But really, where they need to know is just how the body is organized. What are the major organ systems? How do we describe one organ to another using different directional terms and body regional terms? And then I get into chemistry, and in the chemistry component of that course, it's not like a traditional college level course. Obviously you'll get the basics of chemistry. So what's an atom? What's a molecule? What binds them together? What are the different types of molecules? We look at inorganic and organic molecules, but I also look at biological transmutations and things in chemistry you would never talk about on campus in a typical college environment. So can things change? Can chemicals transmutate? And there's some theory about that is more esoteric, but I think it is worthwhile to learn about. And then I get into cell biology. The cell is the smallest unit of life, so I think it's very foundational to learn what the cell does, because all of our organs and tissues are made up of cells. And then we get a little bit into histology, which are tissues, and we look at the 4 major tissue types. That's all in course 1. So that's kind of an introduction to anatomy and physiology. Before we start talking about any particular organ, we need to have that understanding. And then with part 2, we're looking at 2 organ systems, the cardiovascular system and the lymphatic system. The cardiovascular system has the heart, the blood vessels, and then the blood that courses through those organs. The lymphatic system includes the lymph, and then all of the major lymphatic organs. We look at the tonsils, we look at the thymus, the spleen, the organs that house our immune cells. And that's why the lymphatic system is tightly knit with the immune system, because the immune system is part of the lymphatic system. So those 2 organ systems, I think, for any individual going into natural healing, you want to have a really good understanding of, because we just build upon that as we move forward. Dr. Morse and I have been talking about the 3rd course already, part 3, where we're going to be looking at the nervous system and the endocrine system, because those 2 organ systems are really kind of controlling everything. Our brain sends electrical signals to control organs and picks up sensory information about our environment. Our hormones, they control a lot as well. We know insulin controls blood glucose levels. Thyroid hormone controls our metabolism. So all of these hormones will be discussed in that part 3 course.
Wow, that's amazing. Okay, let's end on society in general. How do you, and the reason why I ask this question, or the question I'm about to ask, is because some years ago, one of the people I was helping was quite ill, bless her, and she was a general practitioner in Eastern Europe. I think it was Lithuania, I can't remember. And while she was learning, she was just about to retire, and she was trying to pass on as much of the information she could to her patients that came into her surgery. And she used to say to me, Marco, they're not interested. I used to say to them, you don't need these blood pressure tablets. You don't need that. Just don't eat the sausage. Just don't keep eating the sausage or the, whatever it is their national dish. And she said they're not interested. So obviously that we can extrapolate that to most of society, most cultures. We're so embedded in our traditions, our customs. I know that my family are Italian, and I was the idiot once in Italy that was telling people that white pasta is not good for you, and they were all looking at me, and I was like, why did I even open my mouth? But how do we have to get through that because we can't keep eating things that are not food and they're making us ill, and we have to change that. How I know the people that come to the courses are interested, they're naturally interested. How do you think we could heal society on a wider scale?
Well, I think it's you. You actually pointed it out earlier that there are certain laws that we need to follow, and that law is natural law. If there's one other person other than Dr. Morse that I've learned a lot that has influenced how I look at the world is a man by the name of Mark Passio. And I highly recommend people look into his work. He has a website called What on Earth is Happening, where he looks at society as a whole, and he gets into the spiritual, he gets into nutrition. But natural law is basically, when we incarnate onto this earth and we have to learn certain life lessons, we have to do so within the confines of natural law, which mean that if you eat food that is processed or food that was tortured before it was killed, that energy and those processed, depleted food molecules, even if they are food at that point, because everything's been stripped away when they're so refined, when that enters your body, that's not doing anything beneficial for you. It's bad energy. It's basically empty calories. There's no phytonutrients. There's no minerals. There's no energy of life, no structured water. A lot of these are dehydrated foods, fiberless foods. And you can't expect to have a body that's vibrant if you're taking in things that are not vibrant, things that are even well below that vibrant level. And it all comes back to energy. So the energy we take in is going to create the energy that we become. And I think if we start at that fundamental level, and having and explaining things that, there are laws, man's law is just an opinion, really, that governmental people come up with, and then they back it up by the gun of the state. That's just opinion. Nature's law is God's law. And these are the laws that are meant to help us learn the lessons we came here to learn. And diet is part of that. So I think, yeah, society definitely, and I'm not here to say I know everything to teach society what it needs to know. I'm just a part of what I have come to find to be beneficial, and that is helping people heal using nature. Because I've seen both the bad and the good sides of how treatments are shared with individuals. And I've seen the very negative ways in which the allopathic system has hurt people. And not only when I was in medicine myself, but also when I was working with clients. And I've heard so many stories of what people have gone through before they find people like you and I, because they've been through the ringer, and it hurt them so much. That's why they're seeking other individuals. So when you're trying to share this with the family, when they have not experienced those life lessons, they probably don't have the ears to hear you. It's not until people get to that point where they're like, oh man, I should have listened to Marco and put the white pasta and thrown it out the window. But yeah, it's the unfortunate way that, people will be more receptive when, life has taught them that they need to be.
Absolutely right. We'll get there. And I just want to thank you because it's been enlightening, and I'll put the links to your courses and to Dr. Morse's online school, of course, in the description. Patty, thank you for your time. I so appreciate it, and I look forward to speaking with you again soon.
Thank you so much, Marco. I've
Thank you.
enjoyed this. Thank you.